Dr. Nhlapo, it's 11 o'clock. We can start.
Thank you very much, Renier. Let me take this opportunity to welcome everyone who is part of this media briefing. I'd like to first and foremost express our appreciation to the journalists from all the media houses that have taken time out of their busy schedules to be with us today. We are very cognizant of the fact that it is a very busy news cycle with the vaccination and the Vuma week coming up. So you taking the time to be with us today is greatly appreciated. It's a partnership that we have developed over the years and hope that we'll continue to have going forward. We are dealing today with a matter that is critically important for doctors and other healthcare professionals. So we do appreciate your presence in this meeting today. Among the summer leadership that will be present today, I'd like to introduce our well-known chairperson, Dr. Angelique Coutier, and maybe she can just show her face for colleagues to. Secondly, we've got the vice chairperson of the association, Dr. Mvuyisi Mzukwa. And additionally, to assist us deal with this matter, we have brought on board as well 3 board members, Dr. Mark Human, Dr. Akhtar Hussain, Dr. Hussain, just maybe wave, and last but certainly not least, Dr. Zanele Bikicha. Dr. Bikicha? Okay. In terms of the process, colleagues, what we'll be doing today, we will ask Dr. Human to lead us in these proceedings. He will read a statement, a prepared statement from SAMA, which all the journalists will get at the end of this presentation. We will then open up the questions to the journalist. I'd like us to proceed in the following manner. We will have 2 batches of questions made up of 4 questions at a time and respond to those. And after the second batch, we'll probably like to bring the meeting to a close unless there are very pressing issues that colleagues would like to address. So without much further ado, I'd like to call upon Dr. Mark Human to read our statement, and we'll then proceed very quickly to opening up the questions to address any of the questions that the journalist might have. Dr. Human?
Thank you very much, Dr. Nhlapo. My name is Mark Human. I'm the chair of the Gauteng branch of SAMA, and I chair the Human Rights Law and Ethics Committee. Obviously, this is quite topical at the moment, especially following what's been circulating recently in the last week of the abuse that some doctors at the Lillian and Ngoyi Healthcare Center in Soweto took literally about a week ago, or less than a week ago. Our media releases as follows. For several years now, the South African Medical Association, or SAMA, has highlighted the poor state of security, specifically of doctors working in public institutions. While the issue of protecting doctors in these institutions is of the greatest importance, incidents of violence continue unabated. SAMA views the lack of provision of proper safety and security for doctors, indeed for all healthcare workers and patients as well, as a major stumbling block to the provision of quality healthcare to all of our citizens. SAMA also highlights some of the more recent incidents involving doctors since 2018. In 2018, there was a break-in at the Temba Hospital doctors' quarters. Doctors were assaulted in Witbank Hospital, and a doctor survived a gunshot at Mapulaneng Hospital. These incidents were reported to the head of department of the Mpumalanga Department Health, and subsequent to this, a meeting was held with the HOD in May of 2018, which resulted in the employment of armed security personnel at these hospitals. In 2019, there was the attempted rape at Pelanomi Hospital. An intern doctor was almost raped by a patient who was subsequently arrested. As with the incidents in 2018, SAMA met representatives from the department, which resulted in tighter security measures. SAMA also offered support to the doctor, which included making sure that counseling was provided by the Department of Health. In 2020, there was theft of a motor vehicle and general concerns about safety at the Universitas Hospital doctor's quarters in Bloemfontein, and there was a shooting of a patient at Kimberley Hospital. In 2021, 2 doctors and a patient were stabbed 3 weeks ago to Kimberley Hospital. Complaints of poor safety at clinics in Cape Town and the Weltevreden Valley Clinic in Samora Michel, the Mzamorhle Clinic, Browns Farm, and the Crossroads Community Health Clinic, and the recent incident that I mentioned at Lillian Ngoyi Healthcare Centre in Soweto. While the country heads towards local government elections in November, SAMA is concerned that security issues faced by doctors falls under the radar. And it is for this reason that SAMA continues to highlight the issues of security and continues to push both national and provincial governments to increase their levels of security at these public institutions so that those trained to care for patients are able to do so knowing that their own safety is protected. As such, SAMA would like to recommend the following. Firstly, institutions should appoint trained and qualified security staff that are dressed in identifiable security uniforms. That is all healthcare institutions. Secondly, recording and documentation of persons coming in and out of each institution should take place, including doctors that are staying in the staff quarters. Thirdly, installation of boom gates should take place at parking areas. Fourthly, access cards should be granted to all staff, and where appropriate, proper access controlled security measures should be implemented. 5, improvement of lighting outside in the parking areas should take place. 6, mobile security guards 24 hours a day. 7, installation of burglar bars and gates at all healthcare facilities. 8, provision of panic buttons at all healthcare facilities. And finally, installation of closed-circuit TV cameras at all facilities. We would like the Department of Health to become proactive in this regard instead of reactively dealing with these issues as they crop up. SAMA's rights remain reserved on failure by the department to implement stricter security measures, which are in any case mandatory as provided for in the Occupational Health and Safety Act 85 of 1993. That ends the official media release. Thank you.
Thank you, Dr. Human. We would like then to move on to the second session of our presentation today, and would open the floor to any questions that the journalists might have. Any questions at all there, colleagues?
Sorry, Dr. Nhlapo. There is apparently a hand from the other participants.
Okay. Thank you, Dr. Mzukwa. There's one, okay, if I could take maybe the hand, and also there's a question from Xolile Bengu, which reads, is the provision of security for nurses and doctors a cost issue? Xolile from the Mercury. So if I could take the hand, please. While maybe we're connecting with that colleague, if I could maybe have our panelists responding to that question. Is the provision of security for nurses and doctors a cost issue? From Xolile Bengu, who is part of the Mercury team.
Chair, can you hear me? Dr. Hussain?
Yes, we can. Yes, we can. Dr. Hussain, please go ahead.
Yes, it's a failure of policy implementation by Department of Health. It's not a failure of a fund or finance, because DOH last 30 years, SAMA has been informing them there is a huge security risks in public sector and private sector, even the clinics where the doctors and nurses are not safe. There are no policy implementation. It's not a cost issue. It's a very simple issue. The basic measures are not done. For example, they are not adherence with the national guideline of safety and security. It not aligns with the World Health Organization guideline. WHO had a very clear guideline for the hospital safety and security for the doctors and nurses. The basics thing, it don't cost that amount of money, like lightning, like cutting the bushes, taking out all the unnecessary gap, like many entrance and exit, which is unchecked. Basic instrument like security checking with the metal detector. Most of the time, those metal detectors are not working. There are CCTV camera, but it's non-functioning. Recording is not done, not checked, not reviewed. And what happened? The job who is given to the security officers and the CEO of the hospital or medical manager, and there are no security team. They're having a meeting. They don't have an agenda as a security priority in the top of this meeting, or their regular meeting for the security. There are no walkabout. They are not checking where are the strategic place to put the security. So those are not cost effective. Those are the people already in the system. They can check all these things to improve if there is a gap. On the top, the DOH and National Department of Health issuing private security. Those are tender private security paying excess amount of money, which is non-trained. They are C and D grade of security. They have no idea how to do the security in a hospital setup. For example, if someone is stealing a baby, security, untrained security will never know. And there's a conflict between the government security and the private sector security, which came through the tender associated security. And those are untrained. So what we are calling here, we need to have a highly trained security in the Department of Health who knows how to handle hospital situation, medical situation to prevent all those crime. And also, we need to have a partnership with the Department of Health that SAMA can receive information from the Department of Health and the institution. How good is the security? Who is going to report the incidents report? Is there any statistic in Department of Health keeping? So we, as a medical association and DOH, can have a partnership and we can help them to improve those security system. If reporting system is not there, and not action is not taking, is not going to improve. We have seen more than 2 million crime happen 2018, 2019. That was the serious crime, 2 million, and including our public sector hospitals and doctors and nurses cases are there. So it's a time for Department of Health to take action and action. It's not a time to discuss anymore, because whistleblowing to the security point don't cost money. To put a lamp or light, it's only 10 rand each bulb, but they're not putting. To fencing the security for the hospital, it don't cost too much money. Thank you.
Thank you, Dr. Hussein. Dr. Pikicha, would you like to add on that? And we've got 3 more questions that I will take after your comment.
Okay, no, thank you very much, colleagues, for taking this time out to join us on this important conversation. I think the message that we strongly agreeing on here with Dr. Hussein and the rest of my colleagues is that the basics initially are not done before we start getting to cost implementation. The basics of physical security, the basics of making sure that there are barriers, making sure that all the strategic points are intact, the lighting, your fencing, all the basics tend to also not be looked at, which is quite important if you're then going to start security within your institutions. But we also need to look at this tendency to privatize security, where institutions themselves don't have their own line of security that actually works in. And this then causes conflict, because who's monitoring those CCTV cameras? Who then is reporting to management? So that becomes an issue with the privatization of security services, and it's almost a disjuncture with what happens with your DOH and how it runs. I think another thing also, we do need to look at the issue of security. As you were saying, there's different grading of security, and how many of these, particularly even if we had to say hotspot identified areas, for instance, your umlazis and things like that, how many actually have security, even though they've actually been identified as hotspots, even by the likes of SAPS? That then becomes critical to what are we saying about the security of our hospitals. You need to remember what hospitals deal with. We deal with the thugs, we deal with people who are inebriated, we deal with criminals who then come right fresh off the scene, and we are there having to deal with them unprotected. Now, this becomes a very dangerous point where you are focusing on saving a life, but unfortunately, we do know the human element of crime. So it's very important that we take the safety and security of our doctors and further health professionals seriously by ensuring that even the basics are done. And like Dr. Hussein said, this is the matter that needs to be implemented. It just needs to be prioritized as a matter of policy.
Okay. Thank you, Dr. Pikic. I've got 3 questions that I will read out and ask our colleagues on the panel to assist us with. The first one comes from the Star. It reads, do you find that Soweto hospitals are a problem? And some people complain that the medical staff is rude. Could you please comment on this? The second one comes from ENCA, I believe. The Lilian doctors say weekends are the worst, with protection coming from the guards, that they are armed, with batons only. They go up against patients with real weapons at times. They are calling for the joint law enforcement efforts to protect the hospitals. They also say that the Department of Health doesn't care for their safety. How are these issues being addressed? And the last one is, what is the Department of Health's response when SAMA address the safety issues for healthcare workers? If I could have the colleagues from the panel responding to those, please. Maybe start with you, Dr. Mzukwa.
Thank you so much, and good morning to all the colleagues who are with us here. We are really dealing with a matter that really is becoming a huge threat to our healthcare institutions. The question, I think there was the second question that you came from the participants. The issue of our security guards who are not armed and who are expected to deal with thugs who are carrying real guns and are a threat to our communities and the doctors in the healthcare institutions. You must remember that there is no proper training, that is tailor-made for healthcare institutions. These are, the training that is done is just done like you are training for a supermarket or something. But we are dealing with the healthcare institution, especially with the emergency units, where you find that gangsters have been fighting and now they come to fight within the hospital. But the second thing is that there is no collaboration between the hospitals and the local SAPS centers like your police stations, in such a way that at times, even if there's something that is happening in the hospital and you want to contact the local police, it's really difficult, to get a quick response. So that is, there is no coordination. These departments are not working together as if they are belonging to different governments. So I do think that there is a collaboration, and people should work together in that regard, so that we protect these healthcare institutions. So the issue here is poor coordination from the level of government. Thank you.
Thank you, Dr. Mzukwa. If I could ask Dr. Hussein maybe to respond on the third question, which was the Department of Health's response when we address this issue, the issue of healthcare workers to them.
Thank you, Chair. We have been reporting regularly to Department of Health. Department of Health just having a knee jerk, and they just have a few meetings. After that, they all go back to sleep. What happened? We have highlighted that those are the area is very high spot, and those are the victimizing patients are getting attacked. They need to put measure, especially satellite police station in the hospital or next to the hospital. That never happened. Only 1 or 2 hospitals, those things happen. And also, we had a meeting with the steering committee of national security, and we used to meet every 3 months. And that meeting also not happening anymore since COVID-19. So from Medical Association, we have been trying our best to cooperate with the Department of Health to move forward, to improve security system, and they haven't done. So what we are thinking now, if Department of Health not serious, we need to take this issue in higher level so that we make sure that doctors, nurses, the patients are protected. It's not only the doctor, patient, even the ambulance, even the health workers, car, vehicles, transport, also getting hijacked, looted, and there no protection on that. And obstruction of the health services also, we need to work on that. And I will appeal also, the community leadership need to take responsibility to protect the doctor, the nurses, the property of the hospital. Recently, during the looting, the doctor's clinic has been vandalized, dialysis center has been destroyed, dental clinics has been destroyed, pharmacy has been destroyed. So we alone, we cannot win this war or this fight. We need to involve our community leader. We need to work together. And also the media have to play a bigger role, that if you going to attack to the doctors and nurses or kill the doctor and nurses, who is going to treat you? Because they are the one treating you when you are sick.
100%.
Thank you, Dr. Hussein. If I could have Dr. Human come in.
Yes, I'd just like to echo exactly what Dr. Hussein is saying. This is not a new problem. This is something we've been dealing with over more than 20 years. Policies and procedures and guidelines have all been written. They're all in place. They're just not being acted upon. And I think that's our frustration. And I think what Dr. Hussein has said about this being multifactorial is absolutely true. This should not just be the sole responsibility of the Department of Health. It might primarily be their responsibility, but they need to be liaising with the police and with the community leaders, as he pointed out. I mean, even in war-torn countries, in war zones, the respect and the dispensation towards healthcare workers is such that they can go in and work and not be attacked in those environments. How can that be different when we're not at war? I mean, it's quite bizarre. And so at a community level, we need to appeal to the public. You can't be attacking your healthcare workers. It will impact on you eventually at some stage. Thanks.
Thank you, Dr. Human. Dr. Mzukwa, you want to add to this question, or would you like to assist with the third question?
Thank you so much, Vusi. I just wanted to address the first question that was relating to Soweto and yes, the attitude of healthcare workers. I think generally, yes, generally townships are a hotspot for this type of security risks. And I think we've already highlighted and we've seen that in bigger townships like Soweto and Umlazi and Kwamashu and all these other townships, we do get serious challenges there. But I want to address the issue of attitudes of healthcare workers. Yes, we do have a few number of those healthcare workers who may have a bad attitude towards patients, but we are talking about very few numbers there. But also, you cannot use that, to use violence against healthcare workers simply because there's one or two that are deemed rude. There are channels of reporting healthcare workers who are rude. You can approach the CEO of the hospital or the matron. It can be that healthcare workers are going to be attacked simply because they are deemed rude. So I think there are channels to address that. So, and most of these cases that were reported on now are not provoked. It's not people that were provoked. The intern that was, they attempted to rape in Free State, there was no issue about her attitude. So in most cases, it's not because healthcare workers are having a bad attitude towards patients, just that we are dealing with a crime that is now encroaching into the hospitals and the healthcare institutions. Thanks, Chair.
Chair, can I just add one point here?
Thank you, Dr. Mzuka. Go ahead, Dr. Hussein.
Thank you, Chair. And with the attitude, it's not that doctors' attitude change. The problem is in public sector, especially the rural hospital and the peri-urban hospital, even the city hospitals. The problem is overcrowding, and especially Friday, Saturday, Sunday night and day. They are overburdened of the problem with the disease and road accidents and murdered and all those cases, casualty emergency is full. And there's a huge shortage of doctors and nurses. And there's only one or two doctors handling 200-300 patients, and everyone is inpatient. They all want the emergency treatment. They all want their best treatment. They're all in a hurry. But what you can do as a one doctor and few nurses to handle so many patients at a time. Most of the time, our doctors are busy with the emergency management, and that's how the crowd get bit upset and stressful situation. The attitude it's not that doctor attitude change because of the workload, overburden, burning situation, overstress. There may be incidents like that, but it's a totally negligence or fault from the Department of Health. Minimum requirement of staffings are not there. They are not appointing enough doctors and nurses. They are not advertising the post to fill up the vacant post for the doctors. Any given time from 2015 to 2021, you will see more than 50% post has been reduced. The vacant posts are not filled. So if I'm working 40 hours and 36 hours in a shift and on call, how I'm going to handle all those emergency and those patients? And then we end up, anyone working more than 24 hours, attitude, even the thinking will change. You cannot work beyond those hours. It's overwork. Thank you, Chair.
Thank you, Dr. Hussein. Dr. Pikicha, would you like to add?
I want to summarize and say something. One, let's be clear that as SAMA, we take a zero tolerance stance on violence. Zero tolerance stance on violence, zero tolerance stance on any sort of gender-based, actions like rape, which have happened to some of our colleagues. That we have a zero tolerance stance on. I then want to come into another reality, colleagues, that we need to face here in this discussion. The communities, as I've highlighted, there needs to be a way of realizing where the hotspots are. The communities that tend to be hotspots tend to be in those areas that themselves find it hard to attract these professionals because of the surroundings. They tend to be in the, the locations, they tend to be in the rural areas, and they themselves already have a hard enough time in terms of attracting health professionals, leading to the shortage of staff, leading to these people being overworked. If this goes unattended, you will then have a crisis to say, Guti, in certain areas, you just are not going to be able to get healthcare professionals going there if at the end of the day, we make them choose between their safety and being able to carry out their duties.
Thank you, Dr. Bigicha. Maybe from all coming from the media fraternity, we'd like to thank you for having taken the time and being with us for this important briefing. I'd like to thank the summer panelists for having shed light on this important issue. And I think the most important thing that comes out here, this is not a matter that only affects doctors and healthcare professionals, but it's a matter that affects the community and the quality of services that are being provided to the patients at the facility level. As the colleagues have indicated, as SAMA, we take this very seriously, and we then appeal to the Department of Health to take the matter seriously. What we had indicated in our statement is that our rights will remain reserved if you do not feel that this matter is given the attention that it deserves. With that, I'd like to thank everybody for having been here. And the press statement will be issued out by our marketing manager, Dr. Simonia Magadi. I'm just looking at this question. Could you please have full names, surnames, and designations of the doctors who have addressed us today? I'll ask the marketing team to please do that. Avila, they will send that through to you. I think with that and no further questions, I'd like to thank everybody who has been part of this, particularly our colleagues from the media fraternity and the senior leadership from the SA Medical Association. Thank you very much.
Thank you. Thank you very much.
Thank you, everyone.
Thank you.
Thank you, colleagues.